Hi, I'm Dr. Malcolm Brock, and I'm Associate Professor of Surgery and Oncology here at the Johns Hopkins Hospital. And my team and I are working on a very exciting, new, promising way of treating cancer. Genetics is the hardware, the actual DNA sequence to describe and tell us how cancer works. Epigenetics is the software. It's how these genes function and work together. To explain how we're going to fight cancer using epigenetics, let's go to the toy box. In the toy box here, this young little fella represents a cancer cell. And we're going to put him right here because he's well protected, as all cancer cells are. You can see all the cancer cells here. They all have armor. Very, very difficult for us to kill these guys. And let's take out of the toolbox this. This represents chemotherapy. And what we presently do is we try to kill these cancer cells. So we use our chemotherapy and we go bam, bam, bam. And sometimes we kill them, but then what we realize is that as soon as we do that, other cancer cells quickly come up, and they're even more protected. They've got their shield, they got their armor, they're on horses. They actually change a little bit, and you can see now that they're even more fortified. We take the chemotherapy and we try to get at them, and we can't really affect them. They become resistant. What was known was that epigenetic therapy did work for liquid tumors, cancers like leukemia. But what we found here at Johns Hopkins that hadn't been shown before was that epigenetic therapy could actually be used with the big cancers such as lung cancer, the solid tumors. What we found when we tested the epigenetic therapy in humans was that, interestingly, it worked in 3 different ways. So let's go back to the toy box. Here's our chemotherapeutic agent that we had before. And if epigenetic therapy, this represents 2 different drugs. One was a chemotherapeutic agent that was old, and the other was a relatively new drug. We put them together, and we put them together at very low doses so that it no longer acted like a chemotherapeutic agent, and instead, at a very low dose, we tried not to kill the cancer cell. Because remember before, when we killed the cancer cell, the others would rush in, and the more fortified ones would even be harder to kill. And what we found is that as he takes up this drug more and more, the genes change. And genes that were silent all of a sudden come back to life, and the cancer cell changes from a cancer cell to a more normal cell. He starts to look more normal. And as soon as that happens, you can see that he can become more vulnerable to all sorts of things. Just by him taking off all of his armor very quickly, he would just die. The second way that epigenetic therapy works is that, again, we sprinkle on some of the sand, and we found that, again, the genes that were silenced come back on, and the armor starts to come off. But it wasn't enough to kill the cell. But then we gave good old chemotherapy, and the chemotherapy, bam, killed the cell. And it even worked better than if it would have worked before the epigenetic therapy was given. Another way we saw that this worked is that just like these cells became more and more normal and defenseless, we would give them immune therapy, here represented by a white blood cell. And we found that the immune therapy also had that added punch where your own immune system all of a sudden would go ahead and take care of defeating the cancer. As you can see, cancer is a formidable foe, much like a full army. We need a lot of different ways to treat it. We know from our previous clinical trials that epigenetic therapy works with lung cancer. But which particular lung cancers and in which patients will it work the best, that is our next frontier.